NCLEX-RN Challenge Exam Questions Free LPN Practice Test with Answers PDF download. Question 1. The physician has ordered RhoGAM for a negative mother with an O-positive baby. RhoGAM should be administered. Here are the options. Option A. Within 72 hours of delivery. Option B. Within 1 week of delivery. Option C. Within 2 weeks of delivery. Option D. Within 1 month of delivery. The correct answer is option A. Within 72 hours of delivery. To prevent Rh isoimmunization, RhoGAM must be administered within 72 hours of delivery or any potential exposure to Rh-positive blood. Question 2. The doctor is assessing a client with suspected meningitis for meningeal irritation. A positive Koenig's sign is charted if the nurse notes. Here are the options. Option A. Pain on flexion of the hip and knee. Option B. Natural rigidity on flexion of the neck. Option C. Pain when the head is turned to the left side. Option D. Dizziness when changing positions. The correct answer is option A. Pain on flexion of the hip and knee. Koenig's sign is positive when the client feels pain or resistance when the leg is extended while the hip is flexed 90 degrees. Question 3. A client with Alzheimer's disease uses her toothbrush to brush her hair. The nurse identifies this behavior as, here are the options. Option A. Agnosia. Option B. Apraxia. Option C. Anomia. Option D. Aphasia. The correct answer is option A. Agnosia. Agnosia is the failure to recognize or identify objects despite intact sensory function. Using a toothbrush as a hairbrush signifies the client does not recognize the object's purpose. Question 4. A client with dementia experiences increased confusion late in the afternoon and before bedtime. This is known as, here are the options. Option A. Chronic fatigue syndrome. Option B. Normal aging. Option C. Sundowning. Option D. Delusions. The correct answer is option C. Sundowning. Sundowning refers to a state of confusion occurring in the late afternoon and spanning into the night, common in patients with dementia. Question 5. A confused client says, I haven't had breakfast, despite eating 30 minutes ago. Which response is best? Here are the options. Option A. You know you had breakfast 30 minutes ago. Option B. I am so sorry that they didn't get you breakfast. Option C. I'll get you some juice and toast. Would you like something else? Option D. You will have to wait a while. Lunch will be here soon. The correct answer is option C. I'll get you some juice and toast. Would you like something else? In dementia care, validation and distraction are better than arguing. Providing a small snack satisfies the immediate request without causing conflict. Question 6. Which side effect is most often associated with the Alzheimer's drug Exel and rivastigmine? Here are the options. Option A. Urinary incontinence. Option B. Headaches. Option C. Confusion. Option D. Nausea. The correct answer is option D. Nausea. Exelin is a cholinesterase inhibitor. Gastrointestinal side effects, especially nausea and vomiting, are very common. Question 7. A client in active labor has a papular lesion on the perineum. Which initial action is most appropriate? Here are the options. Option A. Document the finding. Option B. Report the finding to the doctor. Option C. Prepare the client for a C-section. Option D. Continue primary care as prescribed. The correct answer is option B. Report the finding to the doctor. Papular or vesicular lesions suggest an active herpes infection. This must be reported immediately as it usually necessitates a C-section to protect the infant from neonatal herpes. Question 8. A client with a diagnosis of HPV is at an increased risk for which of the following? Here are the options. Option A. Hodgkin's lymphoma. Option B. Cervical cancer. Option C. Multiple myeloma. Option D. Ovarian cancer. The correct answer is option B. Cervical cancer. Human papillomavirus (HPV) is a primary risk factor for the development of cervical dysplasia and cervical cancer. Question 9. A client reports a small blister on the vulva that is painful to touch. The nurse is aware that the most likely source of the lesion is. Here are the options. Option A. Syphilis. Option B. Herpes. Option C. Gonorrhea. Option D. Condylomata. The correct answer is option B. Herpes. Painful, fluid-filled blisters vesicles on the genitalia are the hallmark sign of a herpes simplex virus HSV infection. Syphilis chancres is typically painless. Question 10. A client is suspected of having an STI. The best confirmatory diagnostic test for Treponema pallidum syphilis is. Here are the options. Option A. Venereal Disease Research Lab VDRL. Option B. Rapid Plasma Region RPR. Option C. Fluorescent Treponemal Antibody FTA. Option D. Thayer-Martin Culture TMC. The correct answer is option C. Fluorescent Treponemal Antibody FTA. VDRL and RPR are screening tests. The FTABS fluorescent treponemal antibody absorption test is the definitive confirmatory test for syphilis. Question 11. Which laboratory finding is associated with HELLP syndrome in a pregnant client? Here are the options. Option A. Elevated blood glucose. Option B. Elevated platelet count. Option C. Elevated creatinine clearance. Option D. Elevated hepatic enzymes. The correct answer is option D. Elevated hepatic enzymes. HELLP stands for hemolysis, elevated liver enzymes, and low platelets. Elevated AST and ALT levels are key diagnostic markers. Question 12. Which method is used to elicit the biceps reflex during a physical assessment? Here are the options. Option A. Thumb on the antecubital space, tap thumb with reflex hammer. Option B. Loosely suspend the arm while tapping the back of the elbow. Option C. Strike the area below the patella while legs dangle. Option D. Strike the muscle insert just above the wrist. The correct answer is option A. Thumb on the antecubital space, tap thumb with reflex hammer. To elicit the biceps reflex, the nurse places their thumb over the biceps tendon in the antecubital fossa and strikes the thumb. Question 13. A primigravida with diabetes is at 34 weeks gestation. Which doctor's order should the nurse question? Here are the options. Option A. Magnesium sulfate 4 gm Roman 4. Option B. Brethine terbutaline 10 mcg Roman 4. Option C. Statol 1 mg Roman 4 push. Option D. Ansef 2 gm IV. The correct answer is option B. Brethine terbutaline 10 mcg Roman 4. Brethine terbutaline is a beta-mimetic used to stop preterm labor, but it can cause significant hyperglycemia, making it dangerous for a diabetic client. Question 14. An amniocentesis at 32 weeks shows an L/S ratio of 1:1 and the presence of phosphatidylglycerol. How should the nurse assess this? Here are the options. Option A. Infant is at low risk for anomalies. Option B. Infant is at high risk for growth retardation. Option C. Infant is at high risk for respiratory distress syndrome. Option D. Infant is at high risk for birth trauma. The correct answer is option C. Infant is at high risk for respiratory distress syndrome. An L/S ratio of 2:1 is needed for lung maturity. A ratio of 1:1 indicates immature lungs and a high risk for respiratory distress syndrome (RDS). Question 15. Which observation in the newborn of a diabetic mother requires immediate intervention? Here are the options. Option A. Crying. Option B. Wakefulness. Option C. Jitteriness. Option D. Yawning. The correct answer is option C. Jitteriness. Jitteriness is a primary sign of hypoglycemia in a neonate, which is a common and dangerous complication for infants of diabetic mothers whose blood sugar drops after birth. Question 16. What is an expected non-toxic side effect of intravenous magnesium sulfate therapy? Here are the options. Option A. Decreased urinary output. Option B. Hypersomnolence. Option C. Absence of knee-jerk reflex. Option D. Decreased respiratory rate. The correct answer is option B. Hypersomnolence. Hypersomnolence, drowsiness, or feeling warm is an expected effect. Decreased urine output, absent reflexes, and respiratory depression are signs of magnesium toxicity. Question 17. If a client receives epidural anesthesia and experiences hypotension, what is the nurse's priority action? Here are the options. Option A. Place her in Trendelenburg position. Option B. Decrease the rate of Roman 4 infusion. Option C. Administer oxygen per nasal cannula. Option D. Increase the rate of the Roman 4 infusion. The correct answer is option D. Increase the rate of the Roman 4 infusion. Epidural anesthesia causes vasodilation. Increasing the Roman 4 fluid rate bolus helps restore blood pressure and maintain placental perfusion. Trendelenburg should be avoided as it can cause the block to move higher. Question 18. Which nursing diagnosis is the highest priority for a client with cancer of the pancreas? Here are the options. Option A. Alteration in nutrition. Option B. Alteration in bowel elimination. Option C. Alteration in skin integrity. Option D. Ineffective individual coping. The correct answer is option A. Alteration in nutrition. Pancreatic cancer causes profound malabsorption and anorexia, making alteration in nutrition, less than body requirements, a critical physiological priority. Question 19. What is the best method for the nurse to use to determine early ascites in a client? Here are the options. Option A. Inspection of the abdomen for enlargement. Option B. Bimanual palpation for hepatomegaly. Option C. Daily measurement of abdominal girth. Option D. Assessment for a fluid wave. The correct answer is option C. Daily measurement of abdominal girth. Daily measurement of abdominal girth at the same location, usually the umbilicus, is the most objective and sensitive way to detect early fluid accumulation and monitor progress. Question 20. An MVA victim has a BP of 80/34 and a pulse of 120. What is the most appropriate priority nursing diagnosis? Here are the options. Option A. Alteration in cerebral tissue perfusion. Option B. Fluid volume deficit. Option C. Ineffective airway clearance. Option D. Alteration in sensory perception. The correct answer is option B. Fluid volume deficit. The low blood pressure and high heart rate tachycardia are classic signs of hypovolemic shock, making fluid volume deficit the priority. Question 21. The nurse is visiting an 18-year-old with osteogenesis imperfecta. Which information causes the most concern? Here are the options. Option A. The client likes to play football. Option B. The client drinks several carbonated drinks per day. Option C. The client has sisters with sickle cell trait. Option D. The client is taking acetaminophen for pain. The correct answer is option A. The client likes to play football. Osteogenesis imperfecta causes extremely brittle bones. Participation in contact sports like football is highly dangerous due to the risk of multiple fractures. Question 22. A client on a transplant unit has a decreased WBC count. What action should the nurse take when a visitor brings a basket of fruit? Here are the options. Option A. Allow the client to keep the fruit. Option B. Place the fruit next to the bed. Option C. Offer to wash the fruit for the client. Option D. Tell the family members to take the fruit home. The correct answer is option D. Tell the family members to take the fruit home. Patients with neutropenia are on a low microbial diet. Fresh fruits, vegetables, and flowers are prohibited because they can harbor fungi and bacteria. Question 23. A post-laryngectomy client becomes unresponsive and pale with a BP of 90/40. What is the nurse's initial action? Here are the options. Option A. Place the client in Trendelenburg position. Option B. Increase the infusion of dextrose in normal saline. Option C. Administer atropine intravenously. Option D. Move the emergency cart to the bedside. The correct answer is option B. Increase the infusion of dextrose in normal saline. The patient is showing signs of shock. The immediate priority is to increase the Roman IV infusion rate to restore circulating volume and stabilize blood pressure. Question 24. A client accidentally pulls out their chest tube. Which action by the nurse is correct? Here are the options. Option A. Order a chest X-ray. Option B. Reinsert the tube. Option C. Cover the insertion site with a Vaseline gauze. Option D. Call the doctor. The correct answer is option C. Cover the insertion site with a Vaseline gauze. If a chest tube is removed, the site must be immediately covered with an occlusive dressing Vaseline gauze taped on 3 sides to prevent air from entering the pleural space pneumothorax. Question 25. A client on warfarin Coumadin has a pro-time patient of 120 seconds. What is the most important intervention? Here are the options. Option A. Assess for signs of abnormal bleeding. Option B. Anticipate an increase in dosage. Option C. Instruct the client regarding therapy. Option D. Increase frequency of neuroassessments. The correct answer is option A. Assess for signs of abnormal bleeding. A patient of 120 seconds is dangerously high. Normal is approx. 11-13s. The patient is at extreme risk for hemorrhage and must be assessed for bleeding immediately. Question 26. Which food selection provides the most calcium for a client who is 4 months pregnant? Here are the options. Option A. A granola bar. Option B. A bran muffin. Option C. A cup of yogurt. Option D. A glass of fruit juice. The correct answer is option C. A cup of yogurt. Yogurt is an excellent source of calcium, providing significantly more approx 300-400 mg than the other options listed. Question 27. Which action indicates the nurse understands the potential side effects of magnesium sulfate? Here are the options. Option A. The nurse avoids BP checks in the right arm. Option B. The nurse places a padded tongue blade at the bedside. Option C. The nurse inserts a Foley catheter. Option D. The nurse darkens the room. The correct answer is option C. The nurse inserts a Foley catheter. Magnesium is excreted by the kidneys. A Foley catheter is essential to ensure urine output is adequate 30 ml/hr. If output drops, magnesium can build to toxic levels. Question 28. A mother refuses a life-saving blood transfusion for her 6-year-old child. What is the most appropriate nursing action? Here are the options. Option A. Ask the mother to leave during the transfusion. Option B. Encourage the mother to reconsider. Option C. Explain the consequences of no treatment. Option D. Notify the physician of the mother's refusal. The correct answer is option D. Notify the physician of the mother's refusal. When a parent refuses life-saving treatment for a minor, the physician and hospital administration must be notified to obtain a court order to treat the child. Question 29. A client was in an explosion and has burns to the face. The nurse should be most concerned about which complication? Here are the options. Option A. Hypovolemia. Option B. Laryngeal edema. Option C. Hypernatremia. Option D. Hyperkalemia. The correct answer is option B. Laryngeal edema. Facial burns and smoke inhalation carry a high risk of airway obstruction due to laryngeal edema. Maintaining a patent airway is the absolute priority APX. Question 30. Which data indicates that the plan of care for a client with anorexia nervosa is effective? Here are the options. Option A. The client selects a balanced diet from the menu. Option B. The client's hemoglobin improves. Option C. The client's tissue turgor improves. Option D. The client gains weight. The correct answer is option D. The client gains weight. The primary physical goal in treating anorexia nervosa is restoration of nutritional status, which is most objectively measured by steady, controlled weight gain. Question 31. Following repair of a fractured tibia and cast application, which assessment should be reported to the doctor? Here are the options. Option A. Pain beneath the cast. Option B. Warm toes. Option C. Pedal pulses weak and rapid. Option D. Itching under the cast. The correct answer is option C. Pedal pulses weak and rapid. Weak and rapid pedal pulses, especially when combined with pain, may indicate compartment syndrome or vascular compromise, which is a surgical emergency. Question 32. The client with varicella will most likely have an order for which category of medication? Here are the options. Option A. Antibiotics. Option B. Antipyretics. Option C. Antivirals. Option D. Anticoagulants. The correct answer is option C. Antivirals. Antiviral medications such as acyclovir are used to treat varicella chickenpox by inhibiting viral replication, especially in high-risk or immunocompromised patients. Question 33. A client is admitted complaining of chest pain. Which of the following drug orders should the nurse question? Here are the options. Option A. Nitroglycerin. Option B. Ampicillin. Option C. Propranolol. Option D. Verapamil. The correct answer is option B. Ampicillin. Ampicillin is an antibiotic. It is not indicated for the treatment of chest pain or cardiac conditions, making it an inappropriate order in an acute cardiac workup. Question 34. Which of the following instructions should be included in a teaching for the client with rheumatoid arthritis? Here are the options. Option A. Avoid exercise because it fatigues the joints. Option B. Take prescribed anti-inflammatory medications with meals. Option C. Alternate hot and cold packs to affected joints. Option D. Avoid weight-bearing activity. The correct answer is option B. Take prescribed anti-inflammatory medications with meals. NSAID and other anti-inflammatory drugs commonly cause gastrointestinal irritation. Taking them with food or milk helps protect the stomach lining. Question 35. A client with acute pancreatitis is experiencing severe abdominal pain. Which of the following orders should be questioned by the nurse? Here are the options. Option A. Meperidine 100 mg IM Q4 hours PRN. Option B. Mylanta 30 cc Q4 hours via NG. Option C. Cimetidine 300 mg POQID. Option D. Morphine 8 mg IM Q4 hours PRN. The correct answer is option C. Cimetidine 300 mg POQID. Patients with acute pancreatitis are typically kept NPO nothing by mouth to rest the pancreas and prevent the release of digestive enzymes. Any oral PO medication order should be questioned. Question 36. The nurse is aware that the doctor has ordered continuous observation for a client in a chemical dependence unit because here are the options. Option A. Hallucinogens create both stimulant and depressant effects. Option B. Hallucinogens induce a state of altered perception. Option C. Hallucinogens produce severe respiratory depression. Option D. Hallucinogens induce rapid physical dependence. The correct answer is option B. Hallucinogens induce a state of altered perception. Hallucinogenic drugs like LSD or PCP cause distorted perceptions and potential psychosis, necessitating continuous observation for the safety of the patient and others. Question 37. A patient arrives at the emergency department complaining of midsternal chest pain. Which nursing action should take priority? Here are the options. Option A. A complete history with emphasis on preceding events. Option B. An electrocardiogram. Option C. Careful assessment of vital signs. Option D. Chest exam with auscultation. The correct answer is option C. Careful assessment of vital signs. Assessment of vital signs is the priority to determine the patient's immediate hemodynamic stability and provide a baseline for emergency care before moving to diagnostics like an EKG. Question 38. Which misunderstanding by the family regarding pneumonia discharge indicates the need for more detailed information? Here are the options. Option A. The patient may resume normal activities as tolerated. Option B. The patient should resume a normal diet. Option C. The patient may discontinue oral antibiotics once symptoms resolve. Option D. The patient should continue use of the incentive spirometer. The correct answer is option C. The patient may discontinue oral antibiotics once symptoms resolve. Patients must complete the entire course of prescribed antibiotics even if they feel better to ensure the infection is fully eradicated and to prevent antibiotic resistance. Question 39. A nurse is caring for an elderly Vietnamese patient in the terminal stages of lung cancer. Which action should the nurse take regarding the family's rituals? Here are the options. Option A. Restrict visiting hours to 2 at a time. Option B. Notify visitors that only clear fluids are allowed. Option C. Keep the other bed in the room unassigned to provide privacy. Option D. Contact the physician to report the unusual rituals. The correct answer is option C. Keep the other bed in the room unassigned to provide privacy. Providing the family with privacy allows them to practice cultural rituals and provide support during the end-of-life process, which is a hallmark of culturally competent care. Question 40. The charge nurse is planning assignments. Which is the most appropriate assignment for the float nurse from labor and delivery? Here are the options. Option A. A 1-week postoperative coronary bypass patient. Option B. A suspected myocardial infarction patient on telemetry. Option C. A patient with unstable angina. Option D. A postoperative valve replacement patient in a non-surgical bed. The correct answer is option A. A 1-week postoperative coronary bypass patient. A float nurse should be assigned the most stable and predictable patient. A 1-week post-op patient is generally stable, whereas the others require specialized cardiac monitoring. Question 41. An 8-year-old child's physician has prescribed glucagon for emergency use. What is the purpose of this medication? Here are the options. Option A. Glucagon enhances the effect of insulin. Option B. Glucagon treats hypoglycemia resulting from insulin overdose. Option C. Glucagon treats lipotrophy from insulin injections. Option D. Glucagon prolongs the effect of insulin. The correct answer is option B. Glucagon treats hypoglycemia resulting from insulin overdose. Glucagon is a hormone that causes the liver to release stored glucose into the bloodstream. It is the standard emergency treatment for severe hypoglycemia. Question 42. An infant with congestive heart failure is receiving diuretic therapy. Which symptom would indicate the dosage may need to be increased? Here are the options. Option A. Sudden weight gain. Option B. Decreased blood pressure. Option C. Slow, shallow breathing. Option D. Bradycardia. The correct answer is option A. Sudden weight gain. In CHF, sudden weight gain indicates fluid retention and worsening heart failure, suggesting that the diuretic dose is insufficient to clear excess fluid. Question 43. A patient taking phenytoin dilantin is experiencing breakthrough seizures. Which serum drug level indicates a subtherapeutic level? Here are the options. Option A. 15 mcg/ml. Option B. 4 mcg/ml. Option C. 10 mcg/ml. Option D. 25 mcg/ml. The correct answer is option B. 4 mcg/ml. The therapeutic range for phenytoin is 10 to 20 mcg/ml. A level of 4 mcg/ml is too low subtherapeutic to effectively prevent seizure activity. Question 44. A patient reports taking 3 acetaminophen tablets every 3 hours for a week. Which symptom suggests toxicity? Here are the options. Option A. Tinnitus. Option B. Diarrhea. Option C. Hypertension. Option D. Hepatic damage. The correct answer is option D. Hepatic damage. Acetaminophen is metabolized by the liver. Excessive chronic intake leads to hepatotoxicity, which can result in jaundice, elevated liver enzymes, and liver failure. Question 45. A nurse is caring for a cancer patient receiving subcutaneous morphine sulfate for pain. Which nursing action is most important? Here are the options. Option A. Monitor urine output. Option B. Monitor respiratory rate. Option C. Monitor heart rate. Option D. Monitor temperature. The correct answer is option B. Monitor respiratory rate. Opioids like morphine can cause life-threatening respiratory depression. Monitoring the respiratory rate is the highest priority for patient safety apps. Question 46. A patient has severe lower leg pain after a fall in a football game. Which is the appropriate next step in assessment? Here are the options. Option A. Apply heat to the painful area. Option B. Apply an elastic bandage to the leg. Option C. X-ray the leg. Option D. Give pain medication. The correct answer is option C. X-ray the leg. If a fracture is suspected, an X-ray is required to confirm the diagnosis before applying bandages or heat, which could cause further injury or mask symptoms. Question 47. Which patient is most likely to have an automatic internal cardioverter defibrillator AKT implanted? Here are the options. Option A. A patient with MI without cardiac muscle damage. Option B. A postoperative coronary bypass patient. Option C. A patient with a history of ventricular tachycardia and syncope. Option D. A patient with a history of atrial tachycardia and fatigue. The correct answer is option C. A patient with a history of ventricular tachycardia and syncope. AKT are indicated for patients at high risk of sudden cardiac death due to lethal ventricular arrhythmias like VTach or VFib. Question 48. A patient is scheduled for an MRI scan for suspected lung cancer. Which of the following is a contraindication? Here are the options. Option A. The patient is allergic to shellfish. Option B. The patient has a pacemaker. Option C. The patient suffers from claustrophobia. Option D. The patient takes antipsychotic medication. The correct answer is option B. The patient has a pacemaker. The strong magnets used in MRI can deactivate or cause a malfunction in a permanent pacemaker, making it a strict contraindication. Question 49. A nurse suspects a patient has developed a pulmonary embolism. Which symptom has the nurse most likely observed? Here are the options. Option A. The patient is somnolent. Option B. The patient suddenly complains of chest pain and shortness of breath. Option C. The patient has developed a wet cough and crackles. Option D. The patient has a fever, chills, and loss of appetite. The correct answer is option B. The patient suddenly complains of chest pain and shortness of breath. The sudden onset of dyspnea, shortness of breath, and pleuritic chest pain are the hallmark signs of a pulmonary embolism. Question 50. Workup reveals the presence of a rapidly enlarging abdominal aortic aneurysm. Which action should the nurse expect? Here are the options. Option A. Admission for observation and medication. Option B. Admission for sclerotherapy. Option C. Admission to surgery for resection. Option D. Discharge home with cardiologist follow-up. The correct answer is option C. Admission to surgery for resection. A rapidly enlarging aneurysm is at high risk for imminent rupture, which is a surgical emergency requiring immediate repair. Question 51. A leukemia patient has a platelet count of 25,000 microliter. Which action should be included in the care plan? Here are the options. Option A. Monitor for fever every 4 hours. Option B. Require visitors to wear respiratory masks. Option C. Consider transfusion of packed red blood cells. Option D. Check for signs of bleeding in urine and stool. The correct answer is option D. Check for signs of bleeding in urine and stool. A platelet count below 50,000 thrombocytopenia puts the patient at high risk for spontaneous bleeding. Monitoring urine and stool for blood is essential. Question 52. A patient is admitted for diagnosis of suspected Hodgkin's disease. Which symptom is typical of Hodgkin's disease? Here are the options. Option A. Painful cervical lymph nodes. Option B. Night sweats and fatigue. Option C. Nausea and vomiting. Option D. Weight gain. The correct answer is option B. Night sweats and fatigue. B symptoms such as drenching night sweats, persistent fever, and fatigue are common systemic manifestations of Hodgkin's disease. Lymph nodes are typically painless. Question 53. If the diagnosis of Hodgkin's disease were correct, which of the following cells would the pathologist expect to find? Here are the options. Option A. Reed-Sternberg cells. Option B. Lymphoblastic cells. Option C. Gaucher's cells. Option D. Reeder's cells. The correct answer is option A. Reed-Sternberg cells. The presence of Reed-Sternberg cells large, multinucleated alloy cells in a lymph node biopsy is the definitive diagnostic marker for Hodgkin's disease. Question 54. A patient is about to undergo bone marrow aspiration and expresses fear. Which is the most effective nursing response? Here are the options. Option A. Warn the patient to stay very still. Option B. Encourage the family to stay in the room. Option C. Stay with the patient and focus on slow, deep breathing for relaxation. Option D. Delay the procedure. The correct answer is option C. Stay with the patient and focus on slow, deep breathing for relaxation. Guided relaxation and a calming presence are effective ways to manage procedural anxiety and help the patient remain still during an invasive procedure. Question 55. A mother is concerned her 2-year-old son is not yet toilet trained for urine. Which statement by the nurse is correct? Here are the options. Option A. The child should have been trained by age 2. Option B. Bladder control is usually achieved before bowel control. Option C. Bowel control is usually achieved before bladder control. Option D. The child should be told no each time he wets. The correct answer is option C. Bowel control is usually achieved before bladder control. Developmentally, children typically achieve bowel control before bladder control. Physiologic readiness for toilet training usually occurs between 24 and 36 months. Question 56. A 14-month-old child will not fall asleep without a bottle of milk. Which instruction by the nurse is correct? Here are the options. Option A. Allow the child to have the bottle at bedtime. Option B. Put juice in the bottle instead of milk. Option C. Give only a bottle of water at bedtime. Option D. Do not allow bottles in the crib. The correct answer is option D. Do not allow bottles in the crib. Bottles in the crib at night are the primary cause of early childhood caries. Bottle rot and increase the risk of choking and ear infections. Question 57. Which of the following actions is not appropriate in the care of a 2-month-old infant? Here are the options. Option A. Place the infant on her back for naps. Option B. Allow the infant to cry for 5 minutes before responding. Option C. Talk to the infant frequently and make eye contact. Option D. Wait until at least 4 months to add cereals to the diet. The correct answer is option B. Allow the infant to cry for 5 minutes before responding. At 2 months, infants are in the trust versus mistrust stage and lack the ability to self-soothe. They require prompt responsiveness to build security. Question 58. Which of the following suggestions would be helpful to prevent constipation in an older patient? Here are the options. Option A. Moderate exercise for 30 minutes each day. Option B. Drink 6-8 glasses of water each day. Option C. Eat a diet high in fiber. Option D. All of the above. The correct answer is option D. All of the above. The combination of physical activity, adequate hydration, and high dietary fiber is the gold standard for preventing and treating constipation non-pharmacologically. Question 59. A child has suspected rheumatic fever. Which of the following observations is not confirming the diagnosis? Here are the options. Option A. A reddened rash over the trunk. Option B. A history of sore throat in the past month. Option C. A negative antistreptolysin OA titer. Option D. An unexplained fever. The correct answer is option C. A negative antistreptolysin OA titer. A positive ASO titer is required to confirm a recent streptococcal infection, which is the necessary precursor for a diagnosis of rheumatic fever. Question 60. A nurse notes a moderate amount of serous drainage on a surgical dressing 24 hours after surgery. Which of the following is the appropriate nursing action? Here are the options. Option A. Notify the surgeon about infection immediately. Option B. Leave the dressing intact. Option C. Remove the dressing and leave the wound open to air. Option D. Change the dressing and document the clean appearance of the wound. The correct answer is option D. Change the dressing and document the clean appearance of the wound. Serous drainage clear/yellowish is normal 24 hours post-op. The nurse should change the dressing to maintain hygiene and inspect the site. Question 61. Which patient complaint regarding a new fiberglass cast on the right radius would cause the nurse to be most concerned about impaired perfusion? Here are the options. Option A. Severe itching under the cast. Option B. Severe pain in the right shoulder. Option C. Severe pain in the right lower arm. Option D. Increased warmth in the fingers. The correct answer is option C. Severe pain in the right lower arm. Unrelieved, severe pain in the affected limb is an early sign of compartment syndrome and impaired tissue perfusion. Question 62. An older patient with osteoarthritis is preparing for discharge. Which of the following information is correct? Here are the options. Option A. Daily exercise helps decrease discomfort. Option B. Joint pain will diminish after a full night of rest. Option C. NSAID should be taken on an empty stomach. Option D. Tylenol is a more effective anti-inflammatory than Motrin. The correct answer is option B. Joint pain will diminish after a full night of rest. Osteoarthritis pain is typically characterized by wear and tear. The pain increases with activity and is relieved by rest. Question 63. Which patient should not be prescribed alendronate Fosamax for osteoporosis? Here are the options. Option A. A patient treated for high blood pressure with an ACE inhibitor. Option B. A patient who is allergic to iodine/shellfish. Option C. A patient on a calorie-restricted diet. Option D. A patient on bed rest who must maintain a supine position. The correct answer is option D. A patient on bed rest who must maintain a supine position. Fosamax requires the patient to remain upright for at least 30 minutes after ingestion to prevent severe esophageal irritation/erosion. Question 64. Which of the following strategies is not effective for the prevention of Lyme disease? Here are the options. Option A. Insect repellent on skin and clothes. Option B. Long-sleeved shirts and long pants. Option C. Prophylactic antibiotic therapy prior to anticipated exposure. Option D. Careful examination of skin and hair for ticks. The correct answer is option C. Prophylactic antibiotic therapy prior to anticipated exposure. Prophylactic antibiotics are not routinely given before an exposure. Prevention focuses on avoiding tick bites and prompt removal. Question 65. Which of the following indicates the need for discontinuation of enrollment for Lyme? Here are the options. Option A. The patient complains of pain from movement. Option B. The area proximal to the site is reddened, warm, and painful. Option C. The Roman force solution is infusing too slowly when the limb is elevated. Option D. A hematoma is visible in the area of the Roman 4 insertion site. The correct answer is option B. The area proximal to the site is reddened, warm, and painful. Redness, warmth, and pain phlebitis require the immediate removal of the Roman 4 to prevent further vein irritation or infection. Question 66. A patient sitting up in bed is dyspneic with crackles in both lung bases after receiving 2 units of blood. Which complication is most likely? Here are the options. Option A. Febrile non-hemolytic reaction. Option B. Allergic transfusion reaction. Option C. Acute hemolytic reaction. Option D. Fluid overload. The correct answer is option D. Fluid overload. Crackles in the lungs and dyspnea are classic signs of transfusion-associated circulatory overload, TACO, or fluid overload. Question 67. A patient in labor has just received an amniotomy. Which of the following is correct regarding this procedure? Select all that apply. Here are the options. Option A. Frequent checks for cervical dilation are needed. Option B. Contractions may become stronger and closer together. Option C. The FHR will be followed closely due to potential cord compression. Option D. The procedure is followed by a gush of amniotic fluid. The correct answer is option C. The FHR will be followed closely due to potential cord compression. After an amniotomy AROM, the primary nursing priority is monitoring fetal heart rate to detect cord compression or prolapse. Question 68. Which instruction regarding a newborn with hyperbilirubinemia is not correct? Here are the options. Option A. Continue to breastfeed frequently. Option B. Follow up with a physician within 72 hours. Option C. Watch for signs of dehydration. Option D. Keep the baby quiet, swaddled, and in a dimly lit area. The correct answer is option D. Keep the baby quiet, swaddled, and in a dimly lit area. Infants with jaundice need exposure to light, natural, or phototherapy to help break down bilirubin. A dimly lit area is counterproductive. Question 69. Which instruction should the nurse provide regarding car safety for a healthy newborn trip home? Here are the options. Option A. restrained in a car seat in the back seat, rear facing. Option B, restrained in a car seat in the front passenger seat. Option C, restrained in a car seat facing forward in the back seat. Option D, the parent may sit in the back seat and hold the newborn. The correct answer is option A, restrained in a car seat in the back seat, rear facing. Safety standards require newborns to be in a rear-facing car seat in the back seat of the vehicle. Question 70. A nurse is administering Roman 4 furosemide to a patient with CHF. After the infusion, which symptom is not expected? Here are the options. Option A, increased urinary output. Option B, decreased edema. Option C, decreased pain. Option D, decreased blood pressure. The correct answer is option C, decreased pain. Furosemide is a diuretic used to reduce fluid volume. It has no direct analgesic properties to decrease pain. Question 71. Which of the following is a contraindication for treatment with tissue plasminogen activator TPA? Here are the options. Option A, worsening chest pain that began earlier in the evening. Option B, history of cerebral hemorrhage. Option C, history of prior myocardial infarction. Option D, hypertension. The correct answer is option B, history of cerebral hemorrhage. A history of intracranial bleeding is an absolute contraindication for thrombolytics TPA due to the risk of fatal hemorrhage. Question 72. Following myocardial infarction, what is the primary purpose of encouraging frequent leg exercises and ambulation? Here are the options. Option A, increases fitness and prevents future heart attacks. Option B, prevents bed sores. Option C, prevents deep vein thrombosis DVT. Option D, prevent constipations. The correct answer is option C, prevents deep vein thrombosis DVT. Ambulation and leg exercises promote venous return and are critical in preventing the formation of deep vein thrombi. Question 73. Which symptom should the nurse expect a patient to exhibit if they are in cardiogenic shock? Here are the options. Option A, hypertension. Option B, bradycardia. Option C, bounding pulse. Option D, confusion. The correct answer is option D, confusion. Decreased cardiac output in cardiogenic shock leads to poor cerebral perfusion, manifesting as confusion, restlessness, or agitation. Question 74. Which of the following is a hereditary risk factor for developing atherosclerosis? Here are the options. Option A, family history of heart disease. Option B, overweight. Option C, smoking. Option D, age. The correct answer is option A, family history of heart disease. A family history of heart disease is a genetic/hereditary factor that increases an individual's risk for atherosclerosis. Question 75. Which of the following facts about claudication is correct? Select all that apply. Here are the options. Option A, oxygen demand is greater than oxygen supply. Option B, pain often occurs during rest. Option C, it is a result of tissue hypoxia. Option D, It is characterized by cramping and weakness. The correct answer is option A. Oxygen demand is greater than oxygen supply. Claudication is ischemia-related pain cramping/weakness that occurs when the muscle's oxygen demand exceeds the available supply. Question 76. Which instruction should be included for a patient with peripheral vascular disease (PVD)? Here are the options. Option A. Walk barefoot whenever possible. Option B. Use a heating pad to keep feet warm. Option C. Avoid crossing the legs. Option D. Use antibacterial ointment to treat skin lesions. The correct answer is option C. Avoid crossing the legs. Crossing the legs compresses vessels and can further impair already compromised circulation in a patient with PVD. Question 77. A patient diagnosed with Raynaud's disease vasospastic disorder is most likely to fit which description? Here are the options. Option A. An adolescent male. Option B. An elderly woman. Option C. A young woman. Option D. An elderly man. The correct answer is option C. A young woman. Raynaud's disease predominantly affects young women, typically between the ages of 15 and 30. Question 78. A pregnant patient on bed rest for 6 days has sudden shortness of breath and chest pain. What is the most likely cause? Here are the options. Option A. Myocardial infarction. Option B. Pulmonary embolism due to DVT. Option C. Anxiety attacks. Option D. Congestive heart failure. The correct answer is option B. Pulmonary embolism due to DVT. Pregnancy and prolonged immobility are major risk factors for DVT, which can lead to a life-threatening pulmonary embolism. Question 79. What is a significant and dangerous complication associated with thrombolytic therapy used in stroke treatment? Here are the options. Option A. Air embolism. Option B. Cerebral hemorrhage. Option C. Expansion of the clot. Option D. Resolution of the clot. The correct answer is option B. Cerebral hemorrhage. The primary risk of thrombolytic therapy is major bleeding, most dangerously a cerebral hemorrhage. Question 80. An infant holds his head in an unusual position and always faces to one side. What is the most likely explanation? Here are the options. Option A. Torticollis. Option B. Craniosynostosis. Option C. Plagiocephaly. Option D. Hydrocephalus. The correct answer is option A. Torticollis. Torticollis rhinic is caused by the shortening or contraction of the sternocleidomastoid muscle, causing the head to tilt. Question 81. Which statement about Osgood-Schlatter disease is correct? Here are the options. Option A. Caused by competitive swimming. Option B. Usually requires surgical intervention. Option C. Patient experiences pain in the inferior aspect of the knee. Option D. Student is trying to avoid physical education. The correct answer is option C. Patient experiences pain in the inferior aspect of the knee. Osgood-Schlatter is an overuse injury causing pain and swelling at the tibial tubercle, just below the knee cap. Question 82. A nurse asks a 13-year-old female to bend forward at the waist with arms hanging freely. Which assessment is being conducted? Here are the options. Option A, spinal flexibility. Option B, leg length disparity. Option C, hypostatic blood pressure. Option D, scoliosis. The correct answer is option D, scoliosis. The Adams forward bend test is the standard screening tool used to detect the spinal curvature or rib hump associated with scoliosis. Question 83. Which characteristic is the nurse least likely to find in a parent who is abusing their child? Here are the options. Option A, low self-esteem. Option B, unemployment. Option C, self-blame for the injury. Option D, single status. The correct answer is option C, self-blame for the injury. Abusing parents often use denial or project blame onto the child. They rarely exhibit genuine self-blame or insight into the injury. Question 84. Which sign or symptom in a 4-year-old child following head trauma would be a cause for concern regarding increased ICP? Here are the options. Option A, bulging anterior fontanel. Option B, repeated vomiting. Option C, signs of sleepiness at 10 p.m. Option D, inability to read short words from 18 inches. The correct answer is option B, repeated vomiting. In a 4-year-old whose fontanels are closed, repeated vomiting is a classic sign of increased intracranial pressure. Question 85. Which observation indicates that a non-immunized child may have rubeola measles? Here are the options. Option A, small blue-white spots visible on the oral mucosa. Option B, the rash begins on the trunk and spreads outward. Option C, there is low-grade fever. Option D, lesions have a teardrop on a rose petal appearance. The correct answer is option A, small blue-white spots visible on the oral mucosa. Complex spots, small blue-white spots on the inner cheeks are a pathognomonic early sign of rubeola. Question 86. Which description of scarlet fever is not correct? Here are the options. Option A, caused by group of streptococcus. Option B, strawberry tongue is a characteristic sign. Option C, petechiae occur on the soft palate. Option D, the pharynx is red and swollen. The correct answer is option C, petechiae occur on the soft palate. While strep can cause petechiae, they are not a defining characteristic of scarlet fever as much as the sandpaper rash and strawberry tongue are. Question 87. A 30 kg child is prescribed Benadryl 25 mg 3x/day. The correct dose is 5 mg/kg/day. Which describes this dose? Here are the options. Option A, it is the correct dose. Option B, the dose is too low. Option C, the dose is too high. Option D, the dose should be increased or decreased depending on symptoms. The correct answer is option B, the dose is too low. Calculation: 30 kg * 5 mg equals 150 mg/day. The current order 25 mg * 3 is 75 mg/day, which is half of the recommended dose. Question 88. Regarding an undescended testes in a 2-month-old, which statement is most accurate? Here are the options. Option A. Normally, the testes are descended by birth. Option B. The infant will likely require surgical intervention. Option C. The infant probably has only one testes. Option D. Normally, the testes descend by 1 year of age. The correct answer is option A. Normally, the testes are descended by birth. In most full-term infants, the testes have already descended into the scrotal sac by the time of birth. Question 89. Nurse Jenny is instilling an otic solution into an adult male client's left ear. Nurse Jenny avoids doing which of the following as part of the procedure? Here are the options. Option A. Pulling the auricle backward and upward. Option B. Warming the solution to room temperature. Option C. Placing the tip of the dropper on the edge of the ear canal. Option D. Placing the client in a side-lying position. The correct answer is option C. Placing the tip of the dropper on the edge of the ear canal. The nurse should avoid touching the ear canal with the dropper tip to prevent contamination of the medication bottle. Question 90. Nurse B should instruct the male client with an ileostomy to report which of the following symptoms? Here are the options. Option A. Absence of drainage from the ileostomy for 6 or more hours. Option B. Passage of liquid stool in the stoma. Option C. Occasional presence of undigested food. Option D. A temperature of 37.6 degrees C. The correct answer is option A. Absence of drainage from the ileostomy for 6 or more hours. Absence of drainage for 6 or more hours in an ileostomy is a sign of a potential bowel obstruction and must be reported immediately. Question 91. Jerry has been diagnosed with appendicitis. He develops a fever, hypotension, and tachycardia. The nurse suspects which of the following complications? Here are the options. Option A. Intestinal obstruction. Option B. Peritonitis. Option C. Bowel ischemia. Option D. Deficient fluid volume. The correct answer is option B. Peritonitis. Fever, hypotension, and tachycardia in a patient with appendicitis are classic signs of peritonitis following a ruptured appendix. Question 92. Which of the following complications should the nurse carefully monitor a client with acute pancreatitis? Here are the options. Option A. Myocardial infarction. Option B. Cirrhosis. Option C. Peptic ulcer. Option D. Pneumonia. The correct answer is option D. Pneumonia. Acute pancreatitis can cause respiratory complications such as pleural effusion, atelectasis, and pneumonia due to inflammatory mediators. Question 93. Which of the following symptoms during the icteric phase of viral hepatitis should the nurse expect the client to inhibit? Here are the options. Option A. Watery stool. Option B. Yellow sclea. Option C. Tarry stool. Option D. Shortness of breath. The correct answer is option B. Yellow sclea. The icteric phase is characterized by the onset of jaundice, which is most easily observed as yellowing of the sclea. Question 94. Marco, who was diagnosed with a brain tumor, was scheduled for craniotomy. In preventing the development of cerebral edema after surgery, the nurse should expect the use of. Here are the options. Option A, diuretics. Option B, antihypertensive. Option C, steroids. Option D, anticonvulsants. The correct answer is option C, steroids. Dexamethasone, a steroid, is commonly used post-craniotomy to reduce inflammation and prevent cerebral edema. Question 95. Halfway through the administration of blood, the female client complains of lumbar pain. After stopping the infusion, Nurse Hazel should. Here are the options. Option A, increase the flow of normal saline. Option B, assess the pain further. Option C, notify the blood bank. Option D, obtain vital signs. The correct answer is option A, increase the flow of normal saline. After stopping a transfusion for a suspected reaction, the nurse must keep the Roman IV line open with normal saline to maintain access for emergency meds. Question 96. Nurse Maureen knows that the positive diagnosis of HIV infection is made based on which of the following? Here are the options. Option A, a history of high-risk sexual behaviors. Option B, positive ELISA and Western blot tests. Option C, identification of an associated opportunistic infection. Option D, evidence of extreme weight loss and high fever. The correct answer is option B, positive ELISA and Western blot tests. A positive ELISA followed by a confirmatory Western blot test is the standard diagnostic protocol for HIV. Question 97. A client with chronic renal failure recognizes an adequate amount of high biological value protein when they select. Here are the options. Option A, raw carrots. Option B, apple juice. Option C, whole wheat bread. Option D, cottage cheese. The correct answer is option D, cottage cheese. High biological value proteins contain all essential amino acids. Dairy products like cottage cheese are excellent sources for CRF patients. Question 98. Kenneth, who is diagnosed with uremic syndrome, has the potential to develop complications. Which among the following should the nurse anticipate? Here are the options. Option A, flapping hand tremors. Option B, an elevated hematocrit level. Option C, hypotension. Option D, hypokalemia. The correct answer is option A, flapping hand tremors. Asterix's flapping hand tremors is a common neurological finding in patients with uremic syndrome or hepatic encephalopathy. Question 99. A client is admitted to the hospital with benign prostatic hyperplasia. The nurse's most relevant assessment would be. Here are the options. Option A, flank pain radiating in the groin. Option B, distension of the lower abdomen. Option C, perineal edema. Option D, urethral discharge. The correct answer is option B, distension of the lower abdomen. BPH causes urinary retention, which leads to a distended bladder that can be palpated in the lower abdomen. Question 100. A client has undergone a penile implant. After 24 HRS, the client's scrotum was edematous and painful. The nurse should. Here are the options. Option A, Assist the client with sitz bath. Option B. Apply warm soaks in the scrotum. Option C. Elevate the scrotum using a soft support. Option D. Prepare for a possible incision and drainage. The correct answer is option C. Elevate the scrotum using a soft support. Elevation of the scrotum reduces edema and provides comfort following genital or pelvic surgery. Question 101. Nurse Hazel receives emergency results for a client with chest pain. An increased myoglobin level suggests. Here are the options. Option A. Liver disease. Option B. Myocardial damage. Option C. Hypertension. Option D. Cancer. The correct answer is option B. Myocardial damage. Myoglobin is one of the first markers to rise following myocardial damage, though it is not as specific as troponin. Question 102. Nurse Maureen would expect a client with mitral stenosis to demonstrate symptoms associated with congestion in the. Here are the options. Option A. Right atrium. Option B. Superior vena cava. Option C. Aorta. Option D. Pulmonary system. The correct answer is option D. Pulmonary system. Mitral stenosis causes blood to back up into the left atrium and subsequently into the pulmonary veins and lungs. Question 103. A client has been diagnosed with hypertension. The nurse's priority nursing diagnosis would be. Here are the options. Option A. Ineffective health maintenance. Option B. Impaired skin integrity. Option C. Deficient fluid volume. Option D. Pain. The correct answer is option A. Ineffective health maintenance. Hypertension is often asymptomatic, and the biggest challenge is ensuring the patient maintains their treatment and lifestyle changes. Question 104. Nurse Hazel teaches the client with angina about common expected side effects of nitroglycerin including. Here are the options. Option A. High blood pressure. Option B. Stomach cramps. Option C. Headache. Option D. Shortness of breath. The correct answer is option C. Headache. Nitroglycerin causes systemic vasodilation, which frequently results in a throbbing headache as a side effect. Question 105. Which of the following is a risk factor for the development of atherosclerosis and PVD? Here are the options. Option A. High levels of low-density lipid LDL cholesterol. Option B. High levels of high-density lipid HDL cholesterol. Option C. Low-concentration triglycerides. Option D. Low levels of LDL cholesterol. The correct answer is option A. High levels of low-density lipid LDL cholesterol. Elevated LDL, the bad cholesterol, is a major contributor to the formation of plaque in the arteries. Question 106. Which of the following represents a significant risk immediately after surgery for repair of aortic aneurysm? Here are the options. Option A. Potential wound infection. Option B. Potential ineffective coping. Option C. Potential electrolyte imbalance. Option D. Potential alteration in renal perfusion. The correct answer is option D. Potential alteration in renal perfusion. Surgical repair of an aortic aneurysm involves cross-clamping the aorta, which carries a significant risk of impaired blood flow to the kidneys. Question 107. Nurse Josie should instruct the client to eat which of the following foods to obtain the best supply of vitamin B12? Here are the options. Option A, dairy products. Option B, vegetables. Option C, grains. Option D, broccoli. The correct answer is option A, dairy products. Vitamin B12 is found naturally in animal products, including meat, eggs, and dairy. It is absent in plant foods. Question 108. Karen has been diagnosed with aplastic anemia. The nurse monitors for changes in which of the following? Here are the options. Option A, bowel function. Option B, peripheral sensation. Option C, bleeding tendencies. Option D, intake and output. The correct answer is option C, bleeding tendencies. Aplastic anemia involves pancytopenia. A low platelet count thrombocytopenia leads to significant bleeding tendencies. Question 109. Lydia is scheduled for elective splenectomy. Before the client goes to surgery, the nurse in charge's final assessment would be, here are the options. Option A, signed consent. Option B, vital signs. Option C, name band. Option D, empty bladder. The correct answer is option B, vital signs. A final set of vital signs provides the baseline for the surgical team and ensures the patient is stable enough to proceed. Question 110. What is the peak age range for acquiring acute lymphocytic leukemia all? Here are the options. Option A, 4 to 12 years. Option B, 20 to 30 years. Option C, 40 to 50 years. Option D, 60 to 70 years. The correct answer is option A, 4 to 12 years. ALL is the most common childhood malignancy, with a peak incidence occurring between the ages of 4 and 12 years. Question 111. Marie with ALL suffers from nausea and headache. These clinical manifestations may indicate, here are the options. Option A, effects of radiation. Option B, chemotherapy side effects. Option C, meningeal irritation. Option D, gastric distension. The correct answer is option C, meningeal irritation. In ALL, leukemic cells can cross the blood-brain barrier, leading to meningeal irritation and increased intracranial pressure. Question 112. Which of the following is contraindicated for a client diagnosed with disseminated intravascular coagulation (DIC)? Here are the options. Option A, administering heparin. Option B, administering Coumadin. Option C, treating the underlying cause. Option D, replacing depleted blood products. The correct answer is option B, administering Coumadin. Coumadin is a long-term oral anticoagulant and is not used in the management of acute DAC. It would be inappropriate and potentially dangerous. Question 113. Which finding is the best indication that fluid replacement for the client with hypovolemic shock is adequate? Here are the options. Option A, urine output greater than 30 ml/hr. Option B, respiratory rate of 21 breaths/minute. Option C, diastolic blood pressure greater than 90 mmHg. Option D, systolic blood pressure greater than 110 mmHg. The correct answer is option A, urine output greater than 30 ml/hr. Urine output of 30 ml/hr or more is the gold standard indicator of adequate organ perfusion and successful fluid resuscitation. Question 114. Which of the following would the nurse include in a teaching plan as an early manifestation of laryngeal cancer? Here are the options. Option A, stomatitis. Option B, airway obstruction. Option C, hoarseness. Option D, dysphagia. The correct answer is option C, hoarseness. Persistent hoarseness is the most common early sign of laryngeal cancer due to the tumor's effect on the vocal cords. Question 115. Immunosuppressive therapy for myasthenia gravis is effective because it. Here are the options. Option A, promotes the removal of antibodies. Option B, stimulates acetylcholine production. Option C, decreases production of autoantibodies. Option D, inhibits the breakdown of acetylcholine. The correct answer is option C, decreases production of autoantibodies. MG is an autoimmune disease where antibodies attack acetylcholine receptors. Immunosuppression lowers the count of these autoantibodies. Question 116. A female client is receiving Roman-4 mannitol. An assessment specific to safe administration of this drug is. Here are the options. Option A, vital signs Q4H. Option B, weighing daily. Option C, urine output hourly. Option D, level of consciousness Q4H. The correct answer is option C, urine output hourly. Mannitol is an osmotic diuretic. Hourly urine output monitoring is required to ensure the kidneys can handle the fluid shift and prevent heart failure. Question 117. What is the primary advantage of using a pen-like insulin delivery device over traditional syringes? Here are the options. Option A, accurate dose delivery. Option B, shorter injection time. Option C, lower cost. Option D, use of a smaller gauge needle. The correct answer is option A, accurate dose delivery. Insulin pens are designed for high precision in dosing, which is their primary clinical advantage over manually drawn syringes. Question 118. To assess for damage to major blood vessels from a fractured tibia, the nurse should monitor for. Here are the options. Option A, swelling of the left thigh. Option B, increased skin temperature of the foot. Option C, prolonged reperfusion of the toes after blanching. Option D, increased blood pressure. The correct answer is option C, prolonged reperfusion of the toes after blanching. Capillary refill reperfusion is a direct measure of peripheral arterial blood flow. A delay suggests vascular damage from the fracture. Question 119. A 65-year-old man is admitted for spinal stenosis surgery. He lives alone in a 2-story house. When should the nurse initiate discharge training and planning? Here are the options. Option A, following surgery. Option B, upon admission. Option C, within 48 hours of discharge. Option D, preoperative discussion. The correct answer is option B, upon admission. Discharge planning should begin upon admission or even preoperatively to ensure all home care needs and potential barriers are addressed early. Question 120. A 5-year-old child appears hesitant to play and frequently asks if it is okay to play with certain toys. Which Erickson stage is the child primarily navigating? Here are the options. Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, autonomy versus shame and doubt. Option D, intimacy versus isolation. The correct answer is option B, initiative versus guilt. Children aged 3 to 6 years are in the initiative versus guilt stage. Excessive hesitation or seeking permission may indicate a struggle with guilt over self-initiated play. Question 121. A 26-month-old toddler is becoming increasingly assertive, wanting to dress themselves, but becomes frustrated and ashamed if they fail. Which Erickson stage is this? Here are the options. Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, autonomy versus shame and doubt. Option D, intimacy versus isolation. The correct answer is option C, autonomy versus shame and doubt. Toddlers 1-3 years are in the autonomy versus shame and doubt stage, where they strive for independence and self-control. Question 122. A 20-year-old young adult expresses concerns about a recent breakup and feels isolated from peers. Which Erickson stage is the young adult primarily navigating? Here are the options. Option A, trust versus mistrust. Option B, initiative versus guilt. Option C, autonomy versus shame. Option D, intimacy versus isolation. The correct answer is option D, intimacy versus isolation. Young adults 18-40 years navigate intimacy versus isolation, focusing on forming deeply personal relationships. Question 123. Which of the following vital signs taken during a school health fair appears to be outside the typical range for the respective age group? Here are the options. Option A, 11-year-old athlete, 90 bpm, 22 rpm, 100/70 mmHg. Option B, 13-year-old female, 105 bpm, 22 rpm, 105/50 mmHg. Option C, 5-year-old male, 102 bpm, 24 rpm, 90/65 mmHg. Option D, 6-year-old female, 100 bpm, 26 rpm, 90/70 mmHg. The correct answer is option B, 13-year-old female, 105 bpm, 22 rpm, 105/50 mmHg. For a 13-year-old, a diastolic blood pressure of 50 mmHg is lower than the typical range, especially alongside a slightly elevated heart rate. Question 124. A 38-year-old female struggles with depression and an anxiety disorder. Which of the following medications is most likely prescribed for these conditions? Here are the options. Option A, amitriptyline level. Option B, calcitonin. Option C. Percolide mesylate permax. Option D. Verapamilcalan. The correct answer is option A. Amitriptyline Elavil. Amitriptyline is a tricyclic antidepressant TCA commonly used to treat depression and sometimes off-label for anxiety. Question 125. A patient has a history of respiratory infection, Legionnaire's disease, and multiple sclerosis (MIS. For which condition would the nurse question the administration of erythromycin? Here are the options. Option A. Recent bacterial respiratory infection. Option B. Past episode of Legionnaire's disease. Option C. Family history of campylobacteriosis. Option D. Long-standing diagnosis of multiple sclerosis. The correct answer is option D. Long-standing diagnosis of multiple sclerosis. Erythromycin is an antibiotic used for bacterial infections. It has no therapeutic role in treating multiple sclerosis, which is a neurological autoimmune disease. Question 126. Based on a history of hyperkalemia, which of the following symptoms reported by the patient would the nurse consider unrelated to an acute episode? Here are the options. Option A. Decreased HR. Option B. Paresthesias. Option C. Muscle weakness of the extremities. Option D. Migraines. The correct answer is option D. Migraines. Hyperkalemia hypotassium affects muscle and cardiac function weakness, bradycardia, paresthesia, but is not a cause of migraines. Question 127. A patient is suspected of having diabetic ketoacidosis (DKA). Which of the following symptoms reported by the patient would the nurse consider atypical for this condition? Here are the options. Option A. Persistent nausea and vomiting. Option B. An insatiable feeling of thirst polydipsia. Option C. A noticeable increase in weight over a short period. Option D. A distinct fruity odor on the breath. The correct answer is option C. A noticeable increase in weight over a short period. DKA typically causes dehydration and fluid loss, leading to weight loss, not a short-term increase in weight. Question 128. A nurse suspects acute meningitis in a patient. Which of the following symptoms reported by the patient would the nurse consider not expected for this condition? Here are the options. Option A. A sudden increase in appetite. Option B. Episodes of vomiting. Option C. High fever and chills. Option D. Sensitivity to light photophobia. The correct answer is option A. A sudden increase in appetite. Meningitis typically causes nausea and a lack of appetite anorexia, not an increase in appetite. Question 129. A patient has red, itchy eyes with a yellowish discharge. Which microorganism is most likely responsible for this bacterial conjunctivitis? Here are the options. Option A. Yersinia pestis. Option B. Helicobacter pylori. Option C. Vibrio cholerae. Option D. Haemophilus aegyptius. The correct answer is option D. Haemophilus aegyptius. Haemophilus aegyptius is a common causative agent of acute bacterial conjunctivitis pink eye. Question 130. A patient with a bullseye rash and joint pain has Lyme disease. Which microorganism is responsible? Here are the options. Option A, Borrelia burgdorferi. Option B, Streptococcus pyogenes. Option C, Bacillus anthracis. Option D, Enterococcus faecalis. The correct answer is option A, Borrelia burgdorferi. Lyme disease is caused by the bacterium Borrelia burgdorferi, transmitted through the bite of infected black-legged ticks. Question 131. An 87-year-old female has increased confusion, falls, and mild left hemiparesis. Which test is most likely to be performed? Here are the options. Option A, CBC complete blood count. Option B, ACD electrocardiogram. Option C, thyroid function tests. Option D, CT scan. The correct answer is option D, CT scan. Sudden onset of hemiparesis, weakness on one side, and confusion in the elderly necessitates a CT scan to rule out a stroke or intracranial bleed. Question 132. An 85-year-old male is losing mobility, gaining weight, and runs the heater even on warm days. Which test is most likely to be performed? Here are the options. Option A, CBC complete blood count. Option B, ACD electrocardiogram. Option C, thyroid function tests. Option D, CT scan. The correct answer is option C, thyroid function tests. Weight gain, lethargy, and cold intolerance running the heater are classic symptoms of hypothyroidism, requiring thyroid function testing. Question 133. A 20-year-old college student is found unconscious with a fever and a rash. Which of the following tests is most likely to be performed first? Here are the options. Option A, blood sugar check. Option B, CT scan. Option C, blood cultures. Option D, arterial blood gases. The correct answer is option C, blood cultures. Fever, rash, and altered consciousness in a young adult suggest meningococcemia or meningitis. Blood cultures are a priority for identifying the pathogen. Question 134. Which behavioral characteristic describes the domestic abuser? Here are the options. Option A, alcoholic. Option B, overconfident. Option C, high tolerance for frustrations. Option D, low self-esteem. The correct answer is option D, low self-esteem. Domestic abusers often have low self-esteem and use violence or control to compensate for feelings of inadequacy. Question 135. The nurse is caring for a client with a long leg cast. Which exercise should the nurse recommend for the affected extremity? Here are the options. Option A, isometric. Option B, range of motion. Option C, aerobic. Option D, isotonic. The correct answer is option A, isometric. Isometric exercises contracting muscle without moving the joint help prevent muscle atrophy while the limb is immobilized in a cast. Question 136. A woman in her first pregnancy has multiple sex partners and is unsure of the baby's father. Which intervention is a priority? Here are the options. Option A, Counsel the woman to consent to HIV screening. Option B. Perform tests for sexually transmitted diseases. Option C. Discuss her high risk for cervical cancer. Option D. Refer the client to a family planning clinic. The correct answer is option A. Counsel the woman to consent to HIV screening. While all are important, counseling for HIV screening is a priority to prevent mother-to-child transmission during pregnancy. Question 137. A 16-month-old child clings to the mother and begins to cry when the nurse enters. What is the initial action by the nurse? Here are the options. Option A. Arrange to change client care assignments. Option B. Explain that this behavior is expected. Option C. Discuss the appropriate use of timeout. Option D. Explain that the child needs extra attention. The correct answer is option B. Explain that this behavior is expected. Separation anxiety and fear of strangers are developmentally normal behaviors for a 16-month-old toddler. Question 138. While planning care for a 2-year-old hospitalized child, which situation is most likely to affect the behavior? Here are the options. Option A. Strange bed and surroundings. Option B. Separation from parents. Option C. Presence of other toddlers. Option D. Unfamiliar toys and games. The correct answer is option B. Separation from parents. For a hospitalized toddler, the greatest stressor is typically separation from their primary caregiver's parents. Question 139. While explaining an illness to a 10-year-old, what should the nurse keep in mind about cognitive development? Here are the options. Option A. They make simple associations of ideas. Option B. They are able to think logically in organizing facts. Option C. Interpretation originates from their own perspective. Option D. Conclusions are based on previous experiences. The correct answer is option B. They are able to think logically in organizing facts. According to Piaget, 10-year-olds are in the concrete operational stage and can think logically about concrete facts and events. Question 140. The nurse has just admitted a client with severe depression. From which focus should the nurse identify a priority nursing diagnosis? Here are the options. Option A. Nutrition. Option B. Elimination. Option C. Activity. Option D. Safety. The correct answer is option D. Safety. In severe depression, the risk of self-harm or suicide is the highest priority. Safety must be addressed before other concerns. Question 141. Which playroom activity should the nurse organize for a group of 7-year-old hospitalized children? Here are the options. Option A. Sports and games with rules. Option B. Finger paints and water play. Option C. Dress-up clothes and props. Option D. Chess and television programs. The correct answer is option A. Sports and games with rules. School-age children 6-12 years enjoy competitive play and games that follow established rules. Question 142. A client is discharged following hospitalization for congestive heart failure. Which rest position is most helpful? Here are the options. Option A. High Fowlers. Option B. Supine. Option C, left lateral. Option D, low Fowler's. The correct answer is option A, high Fowler's. High Fowler's sitting upright decreases venous return and eases the work of breathing, which is essential for CHF patients. Question 143. Which assessment parameter indicates that a 10-year-old on the burn unit has adequate fluid replacement? Here are the options. Option A, urinary output of 30 ml per hour. Option B, no complaints of thirst. Option C, increased hematocrit. Option D, good skin turgor around burn. The correct answer is option A, urinary output of 30 ml per hour. Urinary output of 0.5 to 1.0 ml/kd/hr, roughly 30 ml/hr for an average child, is the best indicator of adequate kidney perfusion and fluid resuscitation. Question 144. What is the priority nursing diagnosis for a patient experiencing a migraine headache? Here are the options. Option A, acute pain related to biologic and chemical factors. Option B, anxiety related to change in health status. Option C, hopelessness related to physiological condition. Option D, risk for side effects related to medical therapy. The correct answer is option A, acute pain related to biologic and chemical factors. The hallmark of a migraine is severe, debilitating pain. Addressing acute pain is the immediate priority. Question 145. Which key item should be included in the teaching plan for newly diagnosed migraine headaches? Select all that apply. Here are the options. Option A, avoid foods with tyramine alcohol, aged cheese. Option B, avoid drugs such as Tagamet and nitroglycerin. Option C, abortive therapy is aimed at the aura phase. Option D, medications can cause rebound headaches. The correct answer is option A, avoid foods with tyramine alcohol, aged cheese. Avoiding triggers like tyramine-rich foods is a cornerstone of migraine prevention and management. Question 146. A patient has a seizure. After the seizure, which action can you delegate to the nursing assistant UAP? Here are the options. Option A, document the seizure. Option B, perform neurologic checks. Option C, take the patient's vital signs. Option D, restrain the patient for protection. The correct answer is option C, take the patient's vital signs. Taking vital signs is within the scope of practice for a nursing assistant. Documentation and neuro checks require nursing judgment. Question 147. You are preparing to admit a patient with a seizure disorder. Which action can you delegate to the LPN/LVN? Here are the options. Option A, complete admission assessment. Option B, set up oxygen and suction equipment. Option C, place a padded tongue blade at the bedside. Option D, pad the side rails before the patient arrives. The correct answer is option B, set up oxygen and suction equipment. LPNs can set up standard safety equipment. Padded tongue blades are contraindicated, and admission assessments must be done by an RN. Question 148. A student is teaching about epilepsy prior to discharge. For which statement should you intervene? Here are the options. Option A, You should avoid consumption of all alcohol. Option B. Wear your medical alert bracelet at all times. Option C. Protect your loved one's airway during a seizure. Option D. It's okay to take over-the-counter medications. The correct answer is option D. It's okay to take over-the-counter medications. The nurse must intervene because many OTC medications like cold medicines can lower the seizure threshold or interact with anti-epileptic drugs. Question 149. Which of the following conditions is linked to more than 50% of clients with abdominal aortic aneurysms? Here are the options. Option A. DM. Option B. HPN. Option C. PVD. Option D. Syphilis. The correct answer is option B. HPN. Hypertension HPN is the leading cause of abdominal aortic aneurysms as the constant high pressure weakens the arterial wall over time.